Aging isn't about slowing down, it's about stepping into your power. Welcome to Don't Let the Old Lady In, the podcast where we challenge outdated beliefs about getting older and embrace wellness, self-love, and confidence. Your host is Lori Gardner, a registered nurse and nationally board-certified health and wellness coach, and she is your guide on this journey to vibrant, mindful living. Each episode will explore topics that nourish your mind, body, and spirit and how to navigate health issues in the healthcare system as you age so you can live with energy, purpose, and joy. Let's get started. Here's your host, Lori Gardner. Have you ever felt lost in the maze of a doctor's office? Or amongst insurance claims, or medical jargon? Have you ever left a doctor's appointment feeling unheard or frustrated? If so, you're not alone. Navigating the healthcare system can feel overwhelming, confusing, and at times downright exhausting. But here's the good news. It doesn't have to be that way. Welcome back to Don't Let the Old Lady In. I'm Lori Gardner, your host and advocate for aging well, mind, body, and spirit. Today, we're tackling one of the most important topics when it comes to thriving in midlife and beyond. How to advocate for yourself, ask the right questions, and get the care you truly deserve. Ladies, we know that midlife and beyond, a percentage of the time, percentage of us are going to have some sort of health. Illnesses, disease, chronic conditions, surgery, and it does require us to be empowered. So that's what this is all about today. Boy, can that healthcare system feel overwhelming between rushed appointments, confusing insurance policies, and endless medical jargon. It's easy to feel lost. In this empowering episode, I'm bringing you inside tips from my perspective as a registered nurse and board-certified health and wellness coach. You'll learn how to confidently navigate the system, advocate for yourself or loved one, choose the right providers, prepare for appointments, and avoid common pitfalls that lead to frustration and delays in care. Whether you're facing a new diagnosis or managing a chronic condition, this episode gives you the tools to become your own best advocate and take control of your health and with clarity and confidence. I will always say, ladies, though, it's so important to have somebody on your side, somebody who's empowered themselves, who's not afraid to ask questions. They take notes. To have somebody by your side. If you don't have a trusted family member or friend that can do that, certainly somebody like myself, a hired advocate, is essential because we want to stay safe and sound out there, ladies, don't we? So let me just start with a personal story of my own, just to give you an idea of what can go on. So in my very early 50s, I had kind of an incidental finding on an image that was a little scary, a little cyst in the pancreas. What's that all about? Anyway, I'm not going to go into all the gory details, but suffice it to say, I had to not only do all the workup, I had to have surgery, I had to find the best surgeon and advocate for myself. And I must tell you, I got 3 opinions. I went into Manhattan. I have to tell you that the main reason I started my business as a nurse healthcare advocate is I saw so many people not getting second opinions, and especially not getting second opinions in Manhattan or at some center of excellence, because, ladies, there can be a difference in your care and your outcomes. I could tell a gazillion stories right now about outcomes that would have been different had they not gotten a second opinion, and not for the better. So I interviewed all 3 surgeons. I looked at their complication rates, their surgical expertise, you name it, I looked at it. And not only that, but I also ended up selecting a surgeon who, his personality, I liked his personality. He was rock solid, calm as a cucumber. And this was going to be a 7+ hour surgery with a lot of sewing, a lot of patients needed, on your feet for a long time. I'm telling you this story because I want to impress upon you all that it is important to take your time, develop the right questions to ask, do the right research, get the people behind you to help you, and know exactly what you're getting into. And that taught me that even myself, I needed an advocate. I thought I could do it all myself. But ladies, that first night in the hospital, not so good. I'll just leave it at that. I thought, I'll send my husband home. He's got kids to care for. Not a great idea. You need somebody at your side at all times. But so, that was a big reason I started my business. And since then, I've helped hundreds of people navigate their health journeys. And it's been nothing but an honor and an amazing journey for me as a nurse, all of that I learned. So let's break down this topic, going over some of these key topics. First one, understanding your patient rights. You have the right to clear, understandable explanations about your health. You have the right to a second opinion. Never feel pressure to accept the doctor's word as final. And ladies, I'm going to say something here. I've had many people say to me their doctor got all kind of twisted up and not too happy when they wanted to get a second opinion. That's when I say it's time to definitely get a second opinion. You may not have the right doctor. All doctors should honor the fact that you want to get a second opinion. You have the right to access your medical records. Always request copies for your personal files. You have the right to refuse treatment or seek alternative options. So that's just a general overview of your patient rights. Moving on to how to choose the right healthcare provider. It's imperative. Research doctors who align with your health values, whether that's holistic medicine, functional medicine, or traditional care. You really want to get somebody you connect with, especially a primary care physician. You want somebody who can be your gatekeeper, your point guard, your quarterback, whatever you want to call it, who really knows your entire case. I will tell you, I recently had to get a primary care physician, and I did my research, and I needed to get somebody locally. All my doctors are in Manhattan. I'm located in New Jersey, but I needed somebody boots to the ground here. Well, I found an amazing primary care physician. She accesses all of my patient portals in Manhattan. She's got a 30,000-foot view on everything that's going on. And she actually will go in and actually recommend some other things be done as she looks at my entire case, which that's what you want, ladies. So you also want to read patient reviews and testimonials about these doctors you might be looking at. And again, I'm going to say read them with a grain of salt because you don't always know. Sometimes you get a doctor gets a bad review because, honestly, there are some patients out there that are maybe in pain. Maybe it's not their fault, but some are just kind of cranky and complaining. So just take it with a grain of salt. But, if you see somebody with stellar 4 or 5 stars, you're doing pretty good. Call the office ahead of time and ask how long is the average wait time for appointments. Ask them, does the doctor take time to answer patient questions? How much time will be allotted? You can ask them, is it best to schedule first thing in the morning or right after lunch so there's not a lot of waiting time? Here's a pro tip from me. A great provider doesn't just diagnose and dismiss. They listen, educate, and involve you in decision making. So in other words, if you go to a first visit and it's less than an hour, I don't know that they're really doing the best job. So let's talk about the basics of health insurance, what you need to know. Now, I want to preface all this by saying this is a great overview of what you need to know, but there's so much more. So again, more research is needed. If you have to have surgery, or if you're in the hospital, if you're diagnosed with a new diagnosis, this is an overview. I just want to emphasize that, especially when it comes to health insurance. But primarily, you need to understand your plan. What's covered? What are the deductibles, the copays, and the out-of-pocket maximums? It's also good to know, is your plan a self-pay plan or is it a premium plan? That simply means a self-funded plan is a plan that your employer decides rather than pay these big premiums to, let's say, United Healthcare or Cigna, they're going to pay for their employees' healthcare costs. They're going to use somebody like Cigna or Blue Cross Blue Shield as their administrator, because they need to have, files claimed and all that. But that's self-funded, okay? If it's not self-funded, it's directly coming out of a Cigna or a United Healthcare. That is the distinction. Now, interestingly, in our experience with navigating health insurance issues, the self-funded plans are a little bit more difficult because they're not as highly regulated as the ones that are a straight insurance company. So, for instance, in New Jersey, when we do appeals and we have issues, we can go directly to the New Jersey Department of Banking Insurance, and we've been pretty effective doing that. The self-funded plans are really governed by the Department of Labor, and a little more difficulty there. I'll just leave it at that. I'm getting really deep in this, but just know your plan. Another thing you should absolutely know is your network. Always confirm if a doctor or specialist is in network before an appointment. That's vital. Although since the time of in-network payments in and out, a bill called the surprise bill has been enacted, and you can't be surprised by a provider's higher out-of-network cost. Typically in the past, if they're out of network, they don't charge the quote-unquote premium that the health insurance company contracts with them. They charge their own amount, and it's significantly higher. So unless they told you they're an out-of-network provider, the cost will be higher, do you agree to engage their services, then that would be a surprise bill, and that is against the law. So, pro tip here with insurance companies, keep track of your medical expenses, even if you just use a simple notebook or an app like MyChart or ZocDoc. Call your insurance company and ask what preventative care services are fully covered under my plan, because many services are free but go unused. Another thing we stress here at Health Advocates is always call your insurance company before surgery, before a procedure, an imaging test, just to make sure it's covered. Absolutely write down the name of the person you spoke to, a reference number asked for. If it's a big ticket item like surgery, an expensive MRI, get it in writing. It's vital to do this. Another important aspect of navigating the healthcare system is effective communications with doctors and specialists. Before your appointment, write down your top 3 concerns so you don't forget them. During the visit, be direct. Instead of saying, I don't feel right, say, I've had persistent joint pain for 3 months. What tests can we do? Remember, you're only there to discuss your health issues, and it's imperative to be clear and specific, because that allows the doctor to be focused and be a diagnoser of those symptoms. So it's very important to prepare ahead of time. When I take a client to a physician, I always have their medical history all set to go, their surgical history, their list of medications, and we go over an agenda. My client and I go over the agenda of what they will say exactly to the physician, because we don't want our time wasted and we don't want to waste their time. And we want to really get focus on what it is we're there for. My pro tip here is bring a trusted friend or family member to important appointments. They can take notes and advocate on your behalf. As I said, I've navigated many hundreds of clients and very, very careful to sit in each appointment, obviously professionally introduce myself, but I sit there just to take notes, and if the client wants me to interject any questions, I might. I think it's imperative that you develop a healing relationship with your doctor, so that's the primary relationship, you and your doctor, no one else, so that's important to focus on. So navigating preventive care and treatment plans. What's the difference? Well, preventive care includes screenings like mammograms, colonoscopies, bone density scans, vaccinations, and wellness visits. Treatment plans involve managing chronic conditions like diabetes, heart disease, or arthritis. So just know the difference. Pro tip: the best way to avoid excessive medical interventions is to stay on top of your preventative care. Don't wait until a problem arises. Be proactive. And I can't emphasize this enough, ladies. That's why I also do the health and wellness coaching, Mind, Body, Spirit, because I feel if you are really in touch with your body and you are making that whole engine move properly, you're eating well, you're moving well, your thoughts, your relationships, your connections are all top-notch, you're going to stave off and be practicing some preventative medicine and not get potentially not get sick. But again, we can't prevent everything. So, pro tips for navigating the system: keep a health journal to track symptoms, medications, and medical visits. Keep it in any way that you're going to do it. Some people still do the old-fashioned binder, a loose leaf binder. They insert all their documents in there. You can use a patient portal to access records and communicate with providers there. Don't hesitate to switch doctors if you feel unheard or disrespected. Your healthcare team is vital. You need to know that you get along with them and they are respectful and they hear what you say and they follow up properly. Also, have an emergency plan in place with medical contacts and key health info. Hopefully a lot of people, I've just talked to a few clients recently that didn't know this. If you have an Apple phone, you can go into the health app that comes with every phone, and you actually can go in there and put in all your vital health information, including medications, emergency contacts. This is essential. Ladies, this is something that if God forbid, you're in a car accident, driving alone, and you might have had some ID on you, but maybe you didn't have a contact number on you. Every nurse and doctor that in the ER knows all they have to do is open your phone and they can access that. And they can see immediately, they'll see your contact person and they'll see any medications you're on or any treatment you're under. So this is really a good pro tip to get yourself set up. So I have a checklist for you that in the show notes you can go and get. I think it's important to have, again, it's an overview of a checklist. It doesn't go into in depth, but it's definitely a great starting point. It definitely check off all these things. So, for instance, before your appointment, you want to research your provider's credentials and reviews. You want to prepare a list of symptoms, concerns, and questions. Bring a health journal tracking symptoms. And then during your appointment, ask, what are my treatment options? And are there any alternative approaches? And what if I do nothing? You can request a copy of lab results and doctor's notes. Take notes or record them with permission to review later. Because the statistic is, ladies, including myself, including people in the medical profession, when you're at a doctor's appointment, 80% of us forget what was said in that visit. So it's important to take notes or record it. After your appointment, follow up on test results. Don't assume no news is good news. I've had that happen with clients. Well, I didn't hear anything, so I guess everything's fine. No, need to call. And anyway, it's important to call just to get your results as well. If something feels off, get a second opinion. Keep a record of medications, side effects, and treatment plans. So again, my call to action to you ladies is to start becoming your own best advocate. Find a trusted friend who can go with you in case things get more complicated. Download the checklist I have for you and keep that by your side. So what's important is your health is yours. It's not up to anyone else to fight for the care you deserve. So by being proactive, informed, and confident, you can navigate the system with ease and get the support you need. As a nurse advocate, I can tell you countless client stories about how having a professional advocate at their side achieve better outcomes. Your health is too important, and our healthcare system is too complex and scary to go it alone. I am always happy to provide a 15-minute and frequently more complimentary consult to discuss how it can be of assistance. Here's a recent testimonial I'm so proud of that I received from a daughter of one of my long-term clients. In quotes, Lori was indispensable in my mother's recovery from cancer. She attended doctor's appointments and helped us to understand all of my mom's actions and options and how to seek them out. With Lori's extensive experience as a nurse, as well as her knowledge of how to navigate the system of hospital care, we were in the best possible hands. As both my brother and I no longer live in New Jersey, we knew that Lori could advocate for my mom when we could not be there. In addition to all of her expertise, Lori is a genuinely loving person and was there every step of the way for my mom. Prior to my mom's cancer, I had dealt with my father's Parkinson's disease and dementia, and all of the care decisions that go along with that. But I never had someone like Lori at my side. The difference of the impact on my life was tremendous. My family is blessed to have had Lori in our life, and if you need a care advocate for a parent or a family member, Lori's the person for you. That is exactly why I do what I do. It brings such joy and honor to be able to help somebody navigate through this really difficult system, especially with difficult diagnoses. So I'd love to hear from you. Have you ever had a frustrating experience with the healthcare system? I would love to hear it. What strategies helped you advocate for yourself? Send me a message or leave me a comment. I read them all. So ladies, I hope this episode was helpful to you. And, we don't want to let that old lady in. So take care of our health. Be proactive. Get those screening tests done. And get an advocate by your side. And that's a wrap on today's episode of Don't Let the Old Lady In. Remember, age is just a number. Your mindset, energy, and passion are what truly define you. If this episode spoke to you, don't keep it to yourself. Share it with a friend. Subscribe and leave a review so we can continue this journey together. You are strong, vibrant, and unstoppable. Until next time, keep living boldly, loving yourself fully, and most importantly, don't let the old lady in.